actually knowing my daughter is in safe hands it's the biggest gift you could possibly ask for.
I'm Angharad Elliott.
And I'm Angharad's mum. Angharad is a very normal girl until she got to about 14, and then she developed severe epilepsy. And within a year it was untreatable, and she had various treatments like brain surgery, neck surgery, every medication known to man, ketogenic diet, and we were even trying her on cannabis medicine. And we were away on holiday in Cornwall, and her epilepsy was particularly bad that holiday, and we were on a cliff walk, and she was a good 3 metres from the edge, but she had a seizure and she catapulted over the cliff, which caused devastating injuries. She was in hospital for 9.5 months, and I can't tell you how many operations she had, lots. Prior to that, I was really aware of what a poor quality of life she lived. She just existed in a sort of epileptic stupor. She couldn't really remember what she did in the afternoon or the morning. If you said, "Who did you see yesterday?" she wasn't able to remember anything at all. And for me it was particularly difficult to be able to come home and then find that she'd had a seizure, she'd done some terrible injury to herself. She's broken her nose 10 times, for example, during seizures, and it was awful to see the number of injuries. So I applied for support from the local health authority and won it. It was quite a struggle, and before the accident we'd just found some carers, and then of course the accident happened and all of that was put on hold, and we regenerated that after Angharad came out of hospital. In fact, when she was at the rehabilitation hospital, one of the carers started going in to see her and built a really fantastic relationship. So Angharad came out of hospital after the accident. Her epilepsy bizarrely is better than before she had her accident. That's another long story. And but she does have considerable physical limitations. They're getting better. She has PT, Pilates and things like that, but she does have physical limitations. She still has seizures, and we are very reliant on and very grateful for the carers that we have.
The support that my carers really provide me is mostly companionship, because in reality, obviously I'm not having seizures all the time or anything, and so mostly it's about just keeping me company for most of the time and helping me get to places, because obviously I with epilepsy I can't drive a car, so they take me to appointments or just to go out to have fun, or just if I need to get food or something. It's more about helping me get around and to keep me company, so I have someone to do stuff with.
And unfortunately, quite a lot of the seizures happen with no warning whatsoever. In fact, all of the seizures happen with 0 warning, but some of them are at night and some of them are in the daytime. So for Angharad, the companionship is hugely important, but as a mother, I love to feel that she's actually got a quality of life, but also just coming home and knowing that she's been safe, and as far as is possible, somebody has supported her if she's had seizures.
I think that 𝐥𝐢𝐤𝐞 has benefited me a lot, because without my carers I would be very alone at home, because for one of the reasons, because both my parents work and neither of my siblings are at home anymore, have both gone to university, so I wouldn't be around anyone else, so I wouldn't have anyone to talk to or do stuff with. And then there's the fact of if I have something like things I need to do outside of the house or appointments and stuff, I can't leave the house on my own, and because I live in a village I can't get to anywhere that I need to go to without either public transport, which I can't use on my own, or a car which I can't drive. So I would be stuck without my carers. And 𝐥𝐢𝐤𝐞 has tried hard to find ones that are good for me, who are around the same age as me and can at least have similar interests to me. We find things on TV, whether movies or TV shows, that we can enjoy together, and We play games with definitely one of my carers I cook once a week with.
So the most important things I was looking for regarding the care with Angharad was, first of all, the safety. The feeling that I would get home and I wouldn't have that sick feeling in my stomach thinking, what's she done? Has she had a seizure? Has she damaged herself? Has anything awful happened? Was foremost, and the confidence at knowing that somebody is there with her is fantastic. It's amazing. But also, I was really aware that she was a young woman who needed stimulation, needed somebody to be with, and most especially after the accident, because that wonderful mind was liberated again. Really, the awful accident sort of brought my daughter back, and knowing that she was going to be stretched, that she was going to be able to try new activities, that she was going to be slightly pushed outside her comfort zone. You know, early games were word games that were starting to bring back all that acquisition of language that she had lost during the seizures. The seizures were so awful that she effectively lost 8 years of her life, so it's bringing all of that back. Stimulating conversations. I mean, we've got a carer who's doing a psychology degree, and so the depth of conversation is fantastic. With 𝐥𝐢𝐤𝐞, we've found that if there is a last-minute problem, suddenly one of our carers is sick or they've had an accident or something like that, they've always been able to come up with somebody who can fill the gap. So we're not in that horrendous situation where there's nobody to cover. I got to the point where I was trying to work at home as much as possible, often in quite difficult situations, just so that I'd be around, so that she'd have company, there was somebody to just watch out if I heard a crash from a seizure. You know, I still work at home, but I don't have to, and it means I can get on with my life. Actually, knowing my daughter is in safe hands it's the biggest gift you could possibly ask for.